Good day. Today we'll talk about how to identify outcomes for health professions education in the context of primary health care and universal health care. The call for reorientation of the medical curriculum or health professions curriculum for that matter overall was brought about by the passing of the universal health care law um, that would eventually require or call for reorientation. So, in response to the Universal Healthcare Law and the implementing guideline, Department of Health, Commission on Higher Education (PRC) issued a joint administrative order guidelines for the reorientation of health professions education curricula and training programs to primary health care. As I mentioned earlier, that is basically the mandate is basically part of our response to Section 2510 of the implementing rules and regulation related to universal health care, which mandated the Commission on Higher Education, PRC, and the Department of Health to reorient healthcare professional and healthcare workers' curriculum towards primary health care. But quickly, what exactly is the Universal Healthcare Law? They're here from a DOH material. You see that the Universal Healthcare Law can be summarized into three areas: the integration area, the UHC law by itself, and the goals of UHC. Depending on how you read it, you can read it backwards or forward. So, but for logical reason, in terms of logic thinking, we can actually start looking at it backwards. So we can talk about the goals of UHC that every Filipino should have access to. So that's basically the thing. You have good outcomes, people are financially protected, and to be able to achieve that, you need the law, right? And the law would have both the guarantee for ensuring that people will have access to quality care, but at the same time, the one in the red highlight also that to make it happen, you have to have health professionals who are ready to provide primary health care, or competent health professionals. Not only, by the way, not only competent, but enough of them uh, that can provide primary care for its Filipino. But of course, technically also, it's important that the whole perspective is within the context of a healthcare delivery system. You cannot just increase the number of healthcare provider and assume that change will happen. It will have to be also, or you have to also address the healthcare system where this particular or the healthcare providers would work. So I said, if you have enough primary care provider, then you probably would be able to achieve the goals of UHC, but that's only one aspect of the equation, as I mentioned earlier. You need the whole health system. But anyway, in response to that, as I mentioned, CHED came up with a CMO, and you notice that in that CMO, CHED came up with some priority outcomes for that would be responsive to universal health care. That will be doctors with social accountability, who can work with other professionals through interprofessional collaboration. Doctors or health professionals who are competent in handling health problems of not only individuals but also families and communities. They should be able to communicate proficiently. It does not necessarily mean that they speak in English or what, but communicate proficiently to patients and to the communities and even to leaders, and promote the use of health system approach in the delivery of service. So these are the outcomes. But how do we develop or eventually achieve this outcome? One is to look at two major uh, development or dimensions. We have the primary healthcare dimension and the public health dimension. Now, we all know that public health is the science and art of preventing disease. So therefore, if you want to develop professionals or health professionals educators that are into public health, they should be able to um, perform activities that would address public health issues. And that would mean we need to differentiate the healthcare industry as a whole and public health. And we all know that the healthcare industry is more of a very individualized approach to healthcare, treating people who are sick. And of course, because of that, even if you look at healthcare financing, you don't see healthcare financing that would address needs of communities or needs of families, but rather more of uh, healthcare insurance that would cater individual member of that particular program or financial, say, program. But when we talk about public health, we talk about not only looking at or managing people, but also looking at the overall needs of the population, and that would require being able to do the following, no, as listed, from tracking disease outbreak, setting safety standards down the line, to and accessing prevention programs. So as you notice, the focus will be on the interpopulation. Um, so how are all this information related to the development of competencies and in a way generating elements of your curriculum? So as in the other slides or the other video that you probably have viewed already, that to develop a curriculum or a program, you don't just look at the individual competencies, but you need to identify what exactly are the variables that would influence the development of the program. And that would be probably your health indicators, healthcare system, goals for the program, as I mentioned earlier, and of course the different challenges that we have to face as a member of the healthcare sector or the healthcare system. And that would mean our HPEd is not only, you know, is not only was not only will not only be developed because of what we want, no, but rather because it is responsive to or should be responsive to the issues that I already mentioned, and that the issues we will highlight for this particular discussion is primary healthcare, universal healthcare, public health, and of course community health. So these three should inspire us in determining the different roles and responsibilities that our graduates should be able to perform. For example, in terms of primary care, there are about seven primary health care roles, and that will be from providing first contact care, providing primary care, providing continuing care, coordinating care, managing patient records, promoting health, implementing public health functions. The acronyms are there. So if they are to be able to perform this role, what responsibilities do should they do first, right? Um, so we will go back to the roles and said here the roles of primary care providers can be converted into statement of program outcomes, meaning all of this together should be able to address the five major roles that you see here, or combination roles as you see here in the illustration. And this particular common program outcomes that are based on our identified roles um, should be, again, the baseline for developing your specific course outcomes. Let's say, for example, you have course outcome in pediatrics, course outcome in biochemistry, the basic science, or course outcome for clinical science. It will have to be, again, in the context of all this. And then this course outcomes, of course, will be the baseline or the basis for determining your intended learning outcome. Remember, looking at it backwards and forward. So you notice that we are analyzing the roles backwards, but we will eventually be implementing the program forward, meaning you need to learn the outcome or to be able to achieve learning outcome first before you can achieve course outcomes, before eventually achieving the program outcomes with PHC or UHC as a major inspiration. So if you are to use, for example, CHED's definition or terms, the lesson outcomes will be the lowest of your outcomes, then followed by the course outcomes, and then of course program outcomes, which technically is common because the list is provided for by the Commission on Higher Education. So therefore, if you are to look into the competency development, like I can there on the top, meaning my graduate can, perform the program outcomes as mentioned, but it can also perform the clinical competencies and public health competencies required of the program outcome. But to be able to do that, you need to be able to identify the responsibilities and the knowledge, skills, attitude requirement in performing the responsibilities and tasks under the identified roles. So if you are to appreciate, for example, the formulation of the outcomes using Bloom's taxonomy, it will be like the basic science can go from introduce, demonstrate, or lower order thinking. But as you go to clinical science, you go from demonstrate to practice. Or if you're looking, for example, at OBE, that will be the IDP framework. But for taxonomy, that probably will be, or not probably, but that will be from remember to eventually create. So that's how you are to clarify your learning outcomes in the context of the major development in UHC and PHC.